And Bob, I would allow you to go ahead and introduce your panelists and anybody else that you want to introduce.
Okay, thank you. This evening I've got to my right Chairman of our Board of Trustees, Mary Buffwack, and to my left I have our Chief Revenue Cycle Officer, Martha Lampley. And again, we certainly appreciate the time that you are giving us tonight to talk about Nashville General Hospital and the authority. And
let me open with just asking you, can you operate within the mayor's proposed budget?
Yes, sir, we can.
And the floor is yours for any comments.
Okay, thank you. Again, just saying we appreciate the time here tonight. We're very proud of our facility, our employees, our mission, and our accomplishments for the last year. So that's what I'd like to kind of focus on this evening and take a little time kind of share those with you. Also wanted to let you know that the employees at Nashville General believe we have something more than just jobs, that we're all part of a healing ministry. And so we look forward each day to go and make an impact on someone's life, and that's pervasive throughout our institution. So I just wanted to share that. I've got some handouts that have been distributed. I'll try and go through these kind of briefly. First, I guess more so for the benefit of those that may be watching, or if there are some new folks here tonight, I really want to just spend just a couple minutes just kind of recapping some key facts about our institution. We're one of 6 safety net hospitals. Basically, that designation indicates that we have obviously a high amount of activity that serves the indigent and the private pay and the uninsured individuals. And like I said, we're one of 6 in the state. We have 150 licensed beds. That's a medium-sized community hospital. 550 full-time employees. And we have significant primary care access. And you'll see in a minute, I've got a chart that shows all the various zip codes from where we draw as our catchment area. And you'll see that we're not limited to one section of the city, but to various surrounding areas. We have about 43,000 clinic visits and 36,000 ED visits. So those are your 2 main areas, obviously, that feed the inpatient hospital as well as the outpatient testing that we do. I think the other thing that's very significant is that we have a educational mission, obviously, in conjunction with Meharry Medical College. They have over 130 residents and over 200 students that rotate through all the various specialties. We also have affiliations with several schools for various allied health teachings. That's with TSU, Trevecca, Vol State, and others. And last but not least, I'd be remiss if I didn't mention that we have the only hospital-based rad tech school here in Middle Tennessee, and they continually excel every year in their annual competitive testing. This next page that's in the packet that I handed out, again, I just really wanted to kind of recap for you the subsidy levels that we've had as the hospital authority. Again, I think it's important, and you'll see that what the history's been, but more so, I think the bottom line is, when you first look at that, your first reaction is, well, how do you bridge the gap? Well, if you look at fiscal year 2013 and 2014, I've added 2 footnotes at the bottom. They had 2 unusual events in both those years. One was the early retirement payouts, and the other one was this past year in order for us to transition both long-term care facilities to the private sector. And you can see those were somewhere between $4 and $5 million as supplemental subsidies. So when you look at the line item in red, $9 million delta, $5 million of it obviously due to the fact that we don't anticipate any one of those major events coming up in the upcoming year. The other thing is obviously the transitioning of those 2 facilities. Knowles Home was about $1.8 million in an annual subsidy, so that's obviously not necessary going forward. Bordeaux, we have included in our budget level, this $35 million, the maximum amount of the subsidy due signature, and that would be, if I can say so, the worst case scenario. I think that they probably beat that, and if they do, obviously then that, again, assists us in making this. And last but not least, obviously the hospital has several significant operational initiatives that we have planned to roll out this whole year that will save millions of dollars. And so basically you add those all together, and that produces the $9 million delta to get to the $35 million that's being proposed for us. Obviously, our continual goal, I think the other thing with this is, our continual goal is obviously to become less dependent upon the city for subsidies. We constantly look for other sources, whether it be patient revenue generated or whether it's other funding mechanisms through state and federal agencies, et cetera. On the next page, again, just a quick snapshot for you all. I mentioned about the payer source and that we're one of 6 designated essential access facilities in the state, basically because of our payer mix and who we serve. A couple of takeaways, I guess, from this is, you can get kind of lost in the pie charts and the colors and all that, but when you look at it, there's 2 things that kind of stick out, and that is that this past year, our self-pay went up at 17% versus 15%. And the comment I'd like to make to that is, I think we all thought maybe the ACA was going to assist with the federal exchanges in trying to get the uninsured to have coverage. Unfortunately, that's not been the case. In our particular case, we had over 5,000 people that were screened for the insurance. Only 45 got actual coverage. So you can see that when you get less than 1%, that's really not a good avenue for us to be able to mitigate our uninsured. And so really what we need as an institution is the expansion of Medicaid. And again, so we would advocate obviously for the state when they look at that. That's what would help us tremendously, is really the expansion of Medicaid. The other takeaway I would say is when you look at the commercial sector, we went from 8% to 7%. That may not seem like a lot, but when you realize that from a realizable net revenue standpoint, they pay probably twice what Medicare pays. So that's a significant decline in your net revenues when that occurs. And basically the situation there is we need capital funding to keep our technology up to speed. That's what draws that patient sector. You have to be competitive in your environment. And I'm very fortunate, I will say, and we're very appreciative that this year we have, I believe, $3 million currently proposed to be allocated to meet our immediate needs, and that's predominantly in our radiology area for a new MR and digital mammo and cath lab, 3 critical areas for us. The equipment's about 10 to 12 years old in all those areas, so that would be a big boost and a big help, so we're very appreciative of that. The next page, again, won't spend a lot of time on it. Again, it's just a chart to show you that the uncompensated care and the charity continue to grow. And again, as I said, we obviously are looking forward, hopefully that day, that Medicaid expansion would help us here. At one time, we did a projection, I think about 6 months ago, what kind of impact would that mean, just so you know the magnitude. We forecast that the expansion of Medicaid would actually produce about $8 to $12 million for us annually. So, consider that when we're considering the funding that we're getting from y'all. That would be almost a third that could be reduced if we could get that kind of federal funding mechanism. On the next page, again, a lot of numbers, but the takeaway there, again, as I mentioned, is we do serve a very large catchment area. We're not just limited in any one of the specific areas of the city, and I'm sure that probably you all, each one of you probably have some constituents that have used us as a healthcare facility, and so I guess the point to that is that, we are far-reaching in this county and in the city, and a lot of folks utilize us. So it's not just a certain niche. I guess now it's bragging time a little bit. If I could, just talk a little bit about our accomplishments over this past year. And I just want to highlight some of the more significant accomplishments that we've had. And I'd be remiss if I didn't mention the first one here and took a little time and tell you that this was a win-win-win-win situation. You don't get those very often. But the transitioning of our Knowles home and our Bordeaux long-term care to privately owned partners is a great benefit to everyone involved. The residents obviously are going to receive enhanced quality of services there. Most likely new facilities, if not renovated facilities. We know that Signature has those plans. Obviously, it's a big boost to the redevelopment of the Bordeaux area. It's a significant improvement for our employees there. They're going to be now with organizations that can compete in those arenas with the healthcare expertise and the capital resources that they need. And last but not least, obviously, there are the financial considerations that will benefit the taxpayers of Davidson County, and that is, as noted here, that over the next 3 years, it should save almost $23 million in subsidy dollars. So again, that by far most significant achievement for this past year. And of course, the Knowles home is being transitioned July 1, so it actually hasn't come to fruition yet, but it's all set to. The other thing, obviously, we as an institution continue to focus on our operational efficiency. We have to. That's an ongoing fiduciary responsibility. This year, our direct operational expenses are down per patient day 15%. Significant savings have been achieved in the supply chain area. We've switched our GPO, not to just throw acronyms out there, that's a group purchasing organization. That's basically where you buy the bulk of your supplies and your drugs when you're in the hospital business. We have a book of business there of about $10 or $11 million, and we flipped GPOs and we netted about a 15% savings on the same items, just price differences. So almost the concept, I guess, of going to Walmart, always the low price, so to speak. We went and got on board with a big GPO that had a lot of leverage. And I will say this, I think that's a common thread theme that we need to be looking at as we go forward to gain efficiencies, is that it's very hard nowadays to be on an island by yourself in the healthcare arena, and you need to look to partner with individuals and other organizations that have that buying clout and expertise, whether it's in the direct purchasing of supplies or whether it's in services and contracts and things like that, and that we're actively pursuing those in other arenas as well to gain such efficiencies. I think a couple of other accomplishments I'd like to mention again. We continue, and I think this has been probably about 3 or 4 years now. We've had the Metro Employee Healthcare Incentive Program. It continues to provide a steady flow of activity to us. We had over 3,000 patient visits this past calendar year, and it netted us about $1.3 million. And again, that's one of those win-win deals. The employees get their out-of-pocket costs waived, and then, of course, the facility, we get commercial-based business, which, again, as I mentioned, is good paying business, and so it works out for the benefit of both. The other thing I'll mention too is this is our 4th year that we received the federal hospital or federal public hospital supplemental funds. As I've mentioned, we try to look for other avenues to fund our operations, and this is a major alternative funding source. Was to the tune of about $12.3 million this past year. There was only 2 hospitals this past year in the state that participated in this because of the criteria. And this upcoming year, they've actually added 1 more, so there'll be 3 hospitals that get to participate. But again, it's a huge boost to us. The RIP program, another acronym, I'm sorry, it's Work-Related Injury Program. Again, I share this only in that it was such a huge success that I just throw this out as an opportunity to think about an application for other Metro departments. We saw that we had an issue with our IOD costs, and so we revamped it and we restructured the program, call it RIP, and we've saved nearly $1 million since we've done that, which is 80% from savings from what our costs were under the IOD program. So again, just to throw that out, we'd love to share our success story with that if there's other departments that would like to kind of follow in that same direction. The last one on that page, we commented that we've upgraded our endoscopy suites. That's a very competitive area. I've written myself a note here. I should go lightly on this subject. For any of y'all that's had any of those before, I think you get what I'm talking about. I'll pass. Let me go on the next page. There's just a couple more accomplishments I'd like to mention. Again, Mammos in May is in full swing right now. We have already booked all 500 slots that we have for our mammography screenings. These are free screenings that we give to women that can't afford to have the screenings done or don't have access to it through their regular physicians, et cetera. And obviously, as we mentioned, 27 lives have been changed since the inception of the program, where we found the undiagnosed cancers and they were treated. So that's a huge success. And again, as I mentioned before, we're very thankful that this upcoming capital budget includes funds for us to get a digital mammography machine. That is the state of technology out there. We're probably the only hospital, I think, I know in Middle Tennessee and maybe in all of the state that doesn't have digital mammo yet. So that would be a big plus for us. Then last but not least, our foundation, Friends in General, they're assisting us in trying to extend our outreach footprint in the community. We've hired a nurse practitioner, and she's going out to several churches in the various communities, trying to reach out to those that have medical needs that may, because of lack of transportation, et cetera, not be able to make it, and assess whether they need to go see a doctor or actually be able to give them some limited medical advice right then and there. And we also would like to provide wellness checks at metro departments in the upcoming year as well as part of that same outreach. We think that if we can get to them and assist them, that we can then kind of steer them and see how they like our facilities, et cetera. Okay, so enough of the bragging. I guess now I'd like to just go to the next page, which kind of outlines our goals and our challenges for the upcoming year. And I guess I'll just focus primarily on two of those. I think those are the two main ones. And again, the first one, I've kind of already hit upon it. Basically, that's to develop a sustainable capital funding program to upgrade our facility and replace the aged equipment. Again, in this upcoming year, as we've said, we're very fortunate and very thankful that the $3 million is being proposed. Again, because it is one of those areas, especially radiology, very expensive equipment, but you've got to have it to be able to remain competitive. Otherwise, those that can have a ticket, if you will, to go anywhere will choose to go to who's got the better technology. I think the other thing is, again, kind of dovetailing a little bit with what we said the nurse practitioner will be doing, is that we also want to continue to redesign our access to our facility as far as primary care goes, and that's in our clinics, in our emergency room. We need to make sure that the emergency room is not bogged down in folks that don't need to have that level of care. And so we are proposing to look at some type of I don't know if I'd call it urgent care, but MediQuick or whatever you want to call those type of facilities where we can obviously triage and then get them in through quickly for their minor illnesses that they might have, and then obviously enhance the ER throughput in the same process. So those are two of the biggest goals that we're looking forward to in the upcoming year. And then strategies as far as the strategic implications for the next year. Obviously, it's an ongoing strategy, but maintaining adequate TennCare safety net funding amidst the proposed changes from ACA. We're the only state in the United States that doesn't have a permanent Medicaid DSH funding mechanism. I just think that's amazing, but it's true. Matter of fact, we have typically in the last couple of years gotten about $2.5 million in state Medicaid DSH payments, and we knew that going into this year they might be questionable. We were due or anticipated $1.5 million this month in June coming up from DSH, but we were informed it would not be paid out, but instead very appreciative to some legislative folks from the state. They got involved with the federal government, and they got a one-year reprieve. It's not dish payments, but they got expanded essential access payments that will basically pay the same amount. So, but it's a Band-Aid approach. So again, we're very concerned with that, and would obviously ask if there's any way we can get support, obviously, with others, that we really need to get that fixed. That's a major glitch. It was one of those things that happened when we first went to TennCare in 1994, that they thought that going to TennCare, that through that waiver program, we wouldn't need to have this payment, but it really is needed. As you know, TennCare rules have changed on the eligibility throughout the years, and so fewer and fewer have been on the rolls, and so those that see the uninsured like us, et cetera, and high TennCare need these additional funds. Again, the other thing, as I mentioned before, we have a very strong educational mission, and so along with that, obviously, is the support of the Meharry Medical Group and recruitment of additional key medical resources. Obviously, these two institutions are basically codependent for our success, and you know, they need quality physicians to further their education mission, just as much as we need, obviously, additional physicians to grow our healthcare activity. And then last but not least, the last strategy on there is getting into the IT world. We're installing a new IT system. It's a complete installation program. It's a new McKesson Paragon platform. And again, we've had a system in place, I think, about 8 years. This one is a very streamlined system. It's appropriate fit for our organization, a community hospital our size. It's less expensive to operate, both from a manpower standpoint, from IT support, as well as your maintenance fees that you have to pay the vendor. We're going to save about $800,000 alone just in the maintenance fees that you have to pay to maintain the system. So again, one of those things that we're trying to hone our operations and mitigate our costs. And obviously, you know, part of this too goes and dovetails into meeting the meaningful use requirements, the electronic medical records that we have to have, as well as the new ICD-10 billing requirements. We were fortunate the ICD-10 billing requirements did get pushed back a year. They were supposed to be in place by this October, but it's October 2015. But again, so we're excited to get moving forward with this. This Paragon project will take a full 12 months. So we don't anticipate actually having it completely installed until June of next year. So that would give us about 4 months to try and get everything ironed out and make sure we meet all those requirements. But anyway, I've kind of, I know, gone through this quickly, but I do know you've had a long day, but I would like to obviously give you the opportunity for some questions and answers at this point.
Thank you, Bob. That was very thorough. Council Lady Moore.
Thank you, Chair. Just brief questions. I was looking at page 11 in your handout, and your bragging rights, I don't blame you. I guess I would brag too if you have some revenue, net revenue. I mean, I would definitely brag. But your first bullet point, what is, Tennessee is only state with no permanent Medicaid DHS funding. What does that mean?
Yeah, Medicaid disproportionate share funding. The Medicaid, you have disproportionate share payments can be made from the two federal arms, Medicare and Medicaid. Medicare obviously is federally regulated and everyone gets that, and we do get some of that as well. But Medicaid is the amount that states determine that they can pay through the Medicaid state program for those facilities that see a high number of low-income and Medicaid patients. Very similar to what we talked about before about essential access. It's kind of similar in that regard. But all states have that as a supplemental payment for those that serve a disproportionate share, except us.
Okay. And then on page 8, and I'm glad to hear that there was a net revenue for Metro Employee Healthcare Incentive Program. Is that included in the top 40 zip code count on page 6?
Yeah, Metro employees would be included in that.
Okay.
Yes, ma'am.
Okay. Well, I tell you, you all did a great job.
Well, thank you.
You're welcome.
Appreciate it.
Thank you. Councilman Claiborne.
Thank you, Mr. Chair. Just a couple of questions. Since I've been here almost every year, there has been talk one way or the other about, considering the possibilities of a trauma center and so on. I guess with the coming online of the trauma center at Skyline, and that's probably out of the any near future consideration then. Would that be correct?
I would have to say, as you say, near future, I would say that's probably true.
Okay.
Trauma center is a very complex service line, and it takes a lot of specialized physicians as well.
Right.
And there's probably, I think it would be hard probably to prove now more so the need when you've got one located up there as well at Vanderbilt.
Okay. You have in here about the success of the Employee Health Care Incentive Program, and since this has been initiated, when your folks have been here, we've always had a question about your reaching out to other entities like the state and some of the other larger employees in and around the area to establish similar partnerships. Is anything being done in that direction, or?
Well, I really don't know if we can do the same program structure, if you will, with other employers. Now, I'd have to check with our legal counsel and see if we can do a similar structuring for other governments. The reason we can do this is because we're self-insured. When you start waiving co-pays and out-of-pockets with other insurers, there's a lot of insurance regulations and rules. They get into it and they start saying, you know what, if you're going to waive the co-pay, then we want a discount too. From the payer themselves will say we want a discount, because that's a disincentive, if you will, for them to utilize health care. And when you take that away, the insurers are saying, gee, now you're giving them a blank check. Basically, they can go out and get it with no cost to themselves, no skin in the game, so to speak. So there's a lot of rules and regs around that, but I certainly would like to follow up, because I do know you're absolutely right. I think last year, my former CEO mentioned something about state, and I'm not sure if we've ever gotten to that point.
Right. And what you're saying is a little different than what we've heard in the past. So if there's a possibility for something with the state, then I think you should certainly look into the possibility there.
Absolutely. We would embrace that.
And then the other question here, it's good to see the subsidy amount go down. Again, that's always been a concern when we see the hospital authority coming, since I've been sitting in here, and to see it dropping like that is a compliment to everybody involved. And you've talked about some of the things that have helped in that's happened recently. But with some of the cost savings that you're talking about and other initiatives that you have in this presentation here, do you anticipate that when you're sitting here in this same hearing next year that subsidy is going to be lower than it is currently?
Well, I certainly hope so. Yes, that's as I mentioned, that's our overarching goal, is to reduce our dependency on our subsidy from the city.
I certainly hope you can achieve your goal.
Yeah.
Thank you.
Thank you.
Thank you. Council Lady Johnson.
Thank you. I have to echo Councilman Claiborne's praise for your leadership. Usually when you come before the council, I know the years that I've started since 2011, this room was almost full with council members ready to just tear the hospital authority up. And, it's a testament today with all of these accomplishments and how you have really streamlined things, and just your management, that you don't have that today. So it's refreshing to see the turnaround and to see the direction that you're going. So I know that you're definitely providing smart leadership to the hospital. My question is, when you listed the unique patient count by the zip codes,
yes,
I noticed that there were a lot of patients that utilized the hospital from the southeast Nashville, Davidson County area. And we had a health fair a few months back with St. Thomas Hospital, where they brought out their mammogrammy bus and provided free mammograms. And we had such a line of women who came to get that they had to actually cut it off. And there were a lot of them that did not get to take advantage of that. So when you said you all were currently doing the mammograms in May, or you're ending up that, or what have you. Right. My question is, I know we have just opened up a Harry facility out in southeast Davidson County. I think it's called Total Health.
I think that's correct.
Okay. How is that being marketed? Because a lot of people in my area don't even know that that's there. The second thing is those free screenings. How does that how does the information filter out into that area of the county so that more women would know that that's available? Because we don't have any hospitals out in our area, in our section of the county. So how does that information get out?
Yeah.
Well, but that Southern Hills is over by Nolensville Road, and when you drive out there, it's a long way away from Bell Road, Hamilton Church Road, the Lake, Smith Springs Road, all those areas. We have nothing. So we were really happy to see something like Total Health come into the Hickory Hollow area. But again, how do you get the information out about those free screenings?
Yeah. Well, first let me address the question or the comment you made about the clinic, I think that you were saying, that just opened up there that Meharry is running. Obviously, that's their clinic by themselves. There is no coordination on that with us.
Okay.
So I was probably as surprised as you were when it was opened up. I have no idea how that's going to be marketed, et cetera. We would love to have the opportunity, and I think that's the other thing is we're fixing to have some meetings with their board soon, talk about strategic planning and how we can kind of navigate the waters together, and things like that. And I think that's one of those areas we have to do better on. We as a partner probably shouldn't have been surprised by something off a campus like that, because obviously we would have liked to have some input, et cetera, and see how we could, work together and facilitate it. And then to address your question about the screenings, that is our one biggest campaign probably of the year now, as to the specific media we use to advertise that. I know we have banners and we put, I thought newspaper ads to that effect. Of course, I will say this, I think that a lot of people, and you've got probably a valid point, I need to follow up and see how we are getting the message out and to what extent. But I know a lot of people just know that Mammals in May comes around every year, and, to a certain extent, it's, I think, probably just word of mouth that they all know that, hey, every year we serve it, because like I said, we didn't even have probably 2 weeks before 500 slots, which is what we typically allocate and what we get the funds for, that we could basically have it all signed up. So, but I think that's a good point.
Now, do you have, honestly, I have to say, I haven't looked on Facebook or anything like that to see if you have a page, but are you on social media? Do you advertise on Channel 3? What?
I don't believe we advertise on television. That's pretty expensive media for us. But I do know we do have a website, and we do have a Facebook.
And the other thing, I agree with Council Lady Moore. I didn't, until she asked that question, I was sitting here struggling, trying to figure out what was, the permanent Medicaid DSH funding, because when you're not in that arena, you're trying to figure out what exactly is this that we're not getting.
Right.
It's disturbing. We want to know from you, what can we do? I don't know if other rural counties or what have you, is there some kind of collaboration of public facilities that are coming together with a lobbyist to encourage the state legislature to push the governor to do something. I don't know what it takes to get this in the state of Tennessee. We need some information on that so that we can provide some help for you on that.
I appreciate that, and I'll be happy to get that information for you.
Thank you.
Councilman Claiborne, do you have a follow-up?
I did, and I don't know, maybe Mr. Rebling, you can help me. For metro departments that advertise on Channel 3, is there a cost involved?
I don't think so, but I'm not 100% positive on that.
Okay, so if the hospital wanted to do something on Channel 3, then they would be considered a...
Sure, I would think so. I don't, would not, yeah, I would think so, yes.
Okay, so I think that's something you might want to look into.
Yeah, thank you.
Okay, I don't see any other people in the queue, so we're going to end on a high note. Bob, final question. If Councilman Bedney is injured playing soccer, will you treat him?
Yes, sir,
That
we will.
continues our theme of World Cup. And finally, I'd be remiss with...
TV there for the watch.
And a TV in the waiting room, absolutely. I would be remiss if I didn't thank our good folks at Channel 3 for televising these proceedings to the public so that our process is transparent, and a special thanks to Elise and Roseanne, Mike, and John for their many long hours. With that, I declare the budget hearings closed.
Yeah, Mr. Rebling.